Thank you for joining me for ACEP's Capital Minute. A look at what's happening in Washington right now that's affecting emergency physicians and patients. I'm Laura Wister. For the next 30 minutes or so, I'm going to give you an update of what's happening in our nation's capital, and then we'll open it up for questions. You can submit them at any time by using the Q&A feature at the bottom of your screen in Zoom, and then I'll answer them live after my update. Here's a taste of what we'll cover today, such as the COVID relief package negotiations, the physician fee schedule budget neutrality advocacy efforts, House Ways and Means RFI on racial inequities, ACEP's mental health poll results, and a teaser of ACEP 20. We'll kick off today with an update on the discussions around the fourth COVID-19 relief package. Negotiations are continuing between House Speaker Nancy Pelosi and Treasury Secretary Steve Mnuchin on a nearly $2 trillion COVID-19 relief package. The path to a vote before the November 3rd election gets narrower by the minute. While Speaker Pelosi has indicated that the negotiations are making progress, there remain key sticking points between both sides as time winds down. Senate Majority Leader Mitch McConnell stated that if the White House and Speaker Pelosi can come to a deal, the Senate would consider the measure. But Senate Republicans have mostly thrown cold water on the prospect of passing broad and expensive legislation, with several rank-and-file Republicans suggesting the votes just aren't there. However, in a largely symbolic effort aimed at providing political cover for vulnerable Republican senators, the Senate this week took up a smaller $500 billion effort targeted at schools, hospitals, and small businesses, as well as extending the Paycheck Protection Program. So as of now, there is skepticism that a deal is possible before the election, but ACEP remains engaged with legislators to ensure that our legislative priorities are included and that any additional COVID-19 legislation provides the resources that emergency physicians need on the front lines of the pandemic. In other Capitol Hill news, there are some updates on our efforts to stave off the potentially devastating physician fee schedule cuts that are slated to take effect on January 1st, 2021. As you may remember, ACEP, along with other medical specialties, has been lobbying Congress to waive the budget neutrality rule, which would turn our hard-won 3% increase in ED/E&M codes for calendar year 2021 into a 6% decrease in Medicare reimbursement. As a result of our advocacy efforts, a bipartisan coalition of 229 House members, comprising more than half of the House of Representatives, sent a letter urging Speaker Nancy Pelosi and Minority Leader Kevin McCarthy to blunt the pay cuts for certain specialties, including emergency medicine. The letter asks for a fix to be included in any upcoming legislation moving through the House and follows a similar letter sent last month by congressional signatories to HHS Secretary Alex Azar and CMS Administrator Verma, asking for regulatory relief in the absence of legislative action. As well, earlier this month, ACEP submitted its 40-page response to CMS on the proposed 2021 physician fee schedule and called for the cuts to be averted and for action on several other priorities for emergency medicine that were in the proposed rule, such as making permanent the telehealth waivers that have allowed emergency physicians to be reimbursed for emergency services provided during the pandemic, and supporting the government's proposal to pay for medication-assisted treatment delivered in the ED starting in 2021 with a new add-on code for E&M. You can find a summary of ACEP's comments as well as our entire letter at acep.org under Federal Advocacy in the Medicare section. On October 2nd, ACEP submitted a response to a request for information from House Ways and Means Committee Chairman Richard Neal regarding the misuse of race within clinical care and racial inequities in healthcare. This RFI follows a request that Chairman Neal had sent to several medical professional societies with specific questions about the use of race in clinical decision support tools and algorithms created by those societies or used in those professions. While ACEP wasn't one of the original societies identified in the chairman's initial letters, ACEP reached out to the committee and specifically asked if we could provide information to the chairman about our numerous efforts to address the issue of racial disparities and health inequities for communities of color, as well as additional perspectives on the use of clinical decision support tools and algorithms and concerns about the use of race as a factor in risk assessments. Ultimately, after ACEP's outreach, Chairman Neal issued the broader RFI open to solicit more responses and recommendations from other groups. ACEP's response highlights efforts by the ACEP Diversity, Inclusion, and Health Equity section, the Social Emergency Medicine section, the Academic Affairs Committee, as well as ACEP's offering of a free eCME course on unconscious bias in clinical practice. On the issue of clinical decision to support tools and algorithms, while we indicated that we are not aware of any tools in use by emergency physicians that raise health equity concerns like those specifically identified in the committee's original outreach, There is growing awareness and attention to these issues, and ACEP is actively engaged in efforts to address health inequities and disparities across the healthcare continuum, especially during this important time during the COVID-19 pandemic. To read ACEP's full response to the Ways and Means Committee, visit acep.org's federal advocacy page, and you'll find it under the Letters to Congress section. To bolster our federal advocacy and PR efforts, ACEP recently conducted a poll, along with Morning Consult, around the existing barriers that you as emergency physicians face to seeking mental health treatment. The full poll results will be released during a press event being held this coming Monday, October 26th, but we wanted to share a few highlights with you today, which underscore what we've heard from you and what we've been saying publicly. Despite the vast majority of emergency physicians who expressed even higher rates of stress and burnout since the pandemic started, nearly half say they are hesitant to seek mental health treatment. When it comes to seeking mental health treatment, 73% of emergency physicians feel there is stigma in their workplace. Nearly 3 in 5 emergency physicians report they would be concerned for their job if they were to seek mental health treatment, with physicians over the age of 45 and rural emergency physicians expressing the greatest concern for their job if they were to seek mental health treatment. More than a quarter report that they have avoided seeking mental health treatment in fear of professional repercussions. Of those who reported not seeking mental health treatment in fear of these repercussions, they cited job security, professional stigma, and future job opportunities as specific reasons why. As I mentioned, ACEP will be releasing the full data during an event for the press on Monday in conjunction with the kickoff of ACEP 20. We'll also be incorporating these data points into our ongoing messaging with state and federal policymakers and others as we push to dismantle the barriers to seeking mental health treatment for emergency physicians and other healthcare workers. Speaking of ACEP 20, I wanted to end with a few teasers of what's to come during this year's unconventional and innovative annual meeting. The public affairs team in ACEP's DC office has a number of exciting courses and opportunities for you to engage with ACEP staff directly to learn what we're doing on the federal advocacy, grassroots, and public relations front. I hope you'll check out our on-demand session, ACEP for You, Advocate for Change, featuring Rebecca Parker and Ryan Stanton, emergency physicians and ACEP members that you may know, and myself, where we'll discuss the key advocacy issues that can affect change for emergency physicians and patients at the state and federal levels. This is the place to learn how to voice your ideas, concerns, and questions, and you'll leave the course with an action plan to develop a relationship with your legislators and advance the critical advocacy agenda for emergency medicine physicians. There are also 2 opportunities to enhance your skills as an ACEP spokesperson. On Tuesday, October 27th at 10 a.m. Central Time, we encourage you to participate in the ACEP Media Spokesperson Training course aimed at increasing your skills and communicating with the news media. Here, you'll learn tips and tricks from ACEP's own Public Relations Director, Maggie McGillick, on preparing for interviews and communicating effectively. In addition, any registrant of ACEP 20 will have free access to PR for the ER, ACEP's Communication Masterclass, which is a short yet comprehensive set of training videos designed to provide you with the fundamentals of effective communications. From overcoming speech anxiety and preparing for an on-camera media interview, to tackling tough questions and using storytelling to drive home your message, in this 1-hour training course, you'll learn from your peers and professional communication experts the latest tips and techniques to make you a captivating and compelling spokesperson. NEMPAC is also sponsoring 2 exclusive events to thank VIP donors in conjunction with ACEP 20. Just days before the upcoming election, join NEMPAC to hear the latest predictions and outlook from world-renowned political analyst and publisher of the Political Report, Charlie Cook. There's also a one-night-only celebration hosted by incoming ACEP President Mark Rosenberg, where Broadway notables will perform tributes to emergency physicians. If you're an ACEP member, it's not too late to join NEMPAC to get access to these exclusive events. To do so, visit emergencyphysicianspac.org. And lastly, we also encourage you to visit us at our ACEP 20 Public Affairs booth in the virtual exhibit hall. Here, you'll be able to learn more about our current activities and how you can get involved. We'll also have staff available each day of the conference if you want to drop in so that you can have your questions answered, or you can even sign up for a short networking meeting with any of our staff through the ACEP 20 platform. But remember, to do all of this, you'll have to register for ACEP 20, which you can do at acep.org/ACEP20, excuse me. So that wraps up our federal advocacy updates. I'll start taking your questions. Remember, you can submit them using the Q&A feature of Zoom that's right at the bottom of your screen. All right, let's see what questions are coming in. Okay. Thank you for working to prevent these harmful reimbursement cuts. What is the likelihood that Speaker Pelosi or Minority Leader McCarthy will be receptive to our ideas to blunt the cuts that we are facing? It's a good question. I think they'll be receptive to the need for action on this. I think they understand that. We have been, and ACEP's lobbyists, as well as some of our leaders, have spoken about this issue to a number of members of Congress at fundraiser events that NEMPAC made possible, where we could engage directly with the members of Congress. And it's to the point now where they definitely have heard the message from emergency physicians and some of the other impacted specialties on these huge cuts that are coming. And they know that something needs to be done. The devil is kind of in the details on that. And there's no easy fix on this. No matter what, it's going to be complicated and expensive for Congress. So one or the other of those, okay, but both together starts to make this pretty hard. And certainly Speaker Pelosi and Minority Leader McCarthy do have a bunch of other priorities right now on their plate with the upcoming elections and just trying to get something passed before then. So we're hoping that something will be done, whether it's by Congress or by CMS. Even just a year delay gives us a little more time to figure out a more long-term solution that can hopefully cut down on some of the complexity, or at least give us time to come up with some of these more complicated long-term solutions. The other issue is that because of this issue is indirectly a result of increases that primary care received for 2020 that we're going to go into effect this year because of the budget neutrality that has to be offset. And there's no kind of clean way to do that without either reducing the increased primary care received, which I think a lot of legislators feel was much needed. And so that's not something they'll want to do, or choosing between specialties that were going to be cut in terms of how much of their cut can be averted, if any. Kind of removing everybody's cut and bringing everybody back to kind of zero would be pretty expensive for Congress to do. We've heard competing kind of budget scores on that, but it would, no matter what, it would be expensive is really the long and the short of it. So they would probably have to do some sort of hybrid solution that either makes some of the cuts less bad for some specialties, while others will maybe have their cuts removed altogether. And so now you're forcing Congress to choose between specialties, and that puts them, from their perspective, in a really uncomfortable position and makes things even harder, and I think will make them even more hesitant. So that being said, we're pushing hard. If it doesn't happen before the election, the next kind of big opportunity will be in whatever year-end lame duck package that Congress will ideally be working on. They'll need to work on something because you have a lot of funding that expires at the end of the year. So they'll have to pass something, but what that'll be remains to be seen. And sometimes it's easier to put these more expensive solutions in with the end of year package with a whole bunch of other expensive stuff, because that, what on its own would be pretty expensive bill to pass, will kind of be hidden amongst all the other much larger numbers that will be considered, and there'll kind of be less scrutiny on it. So that will be our next target if that doesn't work. Another question just came in. That says, does Congress truly recognize the importance of a fully resourced front line at this challenging time? I think they recognize it. I'm quite sure that they recognize it, but I think the reality of that, they're facing a lot of competing interests right now from constituents and just from the nation as a whole in terms of getting through this challenging time. Certainly, they're hearing a lot from schools, the importance of having fully resourced schools, protecting teachers, protecting students, the economy, hospitals, PPE. Obviously, that's part of a fully resourced front line, but there's just a lot that they're trying to, I think, navigate. And then if that wasn't enough, we have sort of a pretty politically charged election that's coming up. And I think that's increasing the pressure and putting everyone in what they feel are uncomfortable positions. Granted, they ran for office, so that's part of their job. But I think this year, more than others, it's just so much worse. And as a result of that, I think while they recognize the importance of a fully resourced frontline, it makes it hard for them to just fix that more easily. I think there's several priorities that we've highlighted for Congress that should go into the next COVID package. And everyone we've talked to in Congress is quite receptive on those things and understands how important they are. But right now, there is no package that is imminently going to pass. So it doesn't matter how understanding and receptive they are. They're just trying to get a package passed, and that's hard enough, much less a package that provides resources for frontline physicians at this time. So I think they get it. They've heard us. We've done a lot to make sure they've heard us. We held in March and April, we held virtual briefings with congressional offices where we had our physicians. The early one in March was with our Washington State physicians, and then the April one was with some New York City and New Jersey physicians to talk about what was happening on the ground in those hotspots. And I think that really brought home what emergency physicians need right now. And we have our policy priorities on COVID-19, which you can see on the website at acep.org/COVID-19, that we've been using to highlight to both legislators and regulators everything that's needed. So they do know and they do get it. And we're going to keep hammering that home until we see some action. There's another question is, prioritizing mental health remains a challenge. How will ACEP use this poll in its advocacy efforts? Well, once you see the poll results on Monday, you'll see it becomes a lot more clear. I mean, we showed you some outtakes of it, but these will be, I think, really compelling statistics for Congress and regulators to listen to. We had a really good sample size of respondents, almost 900 respondents, emergency physicians responded. So I think that's a pretty compelling set of data that they'll take notice of. We did it in conjunction with Morning Consult, which is pretty widely regarded, well regarded on the Hill, and people pay attention to. So what we'll be doing is we're having that press event on Monday, and that will be to kind of launch the poll results. And then we'll build off of that for our advocacy. We're continuing to advocate for Congress to pass the Dr. Lorna Breen Provider Protection Act, which was named after Dr. Breen, who was an ACEP member who died as a result of suicide in April, following efforts to combat COVID-19 in her New York City emergency department. And so we're pushing for that bill to be passed. And these poll results are just a really helpful set of data points to, I think, help members of Congress and staff understand the barriers that emergency physicians and others face in trying to seek mental health treatment and everything that's going on there. So we'll definitely be using it as part of the advocacy for that bill. There were other data points in that poll that you'll find out more of on Monday about more specific impacts that the pandemic has had, both on mental health, burnout, and financial situation for emergency physicians. So we'll be able to use the results in other advocacy, not just on mental health for providers. Let's see if there's any other questions. So along those same lines, we have another question about that, which is, what's the status of the Lorna Breen bill or other mental health legislation we're championing? The Lorna Breen bill, and then there's another bill from Representative Raja Krishnamurthy of Illinois that has a similar approach. And then Dr. Burgess introduced an amendment that also tries to address some of these barriers to seeking care. And so we are pushing hard for all of those to be in whatever COVID relief package is next, whether that's one that could happen potentially before the election, although we're not really holding our breath on that one, or in a year-end package. We are working hard to get those in there. And again, the poll results that we have and the press event on Monday are going to really help us push for that. And we'll also be doing a series of virtual Hill meetings on this issue with some key folks who can speak well to this issue. All right, I think got a couple more questions coming in. I'd like to share, the question is, I'd like to share an anonymous story about my mental health with ACEP to use for our advocacy efforts. How can I do that? And I do know we have a URL set up for that, and maybe somebody can send it to me while I'm talking. I'm trying to look for it too. We will post that at the end of the presentation, unless I can find it. Sorry, I'm still digging for it. Too many URLs. Certainly on Monday, we'll have a landing page set up with all of our poll results once those go live. And I believe we'll have a link on there to share additional stories if anybody is wanting to do that. I do want to emphasize the importance of having these stories. We are looking for stories of emergency physicians who either were hesitant to seek mental health treatment because of potential repercussions for their career or their current job, but then also for any who did actually face some of these repercussions to their career after seeking mental health treatment, whether they had to disclose it on a state licensure renewal or hospital credentialing. That's the type of stories we're also trying to collect. We did get some short quotes in the morning consult poll, kind of full text ones versus the multiple choice respondents that I think do talk where different emergency physicians responded, obviously anonymously, about some of their fears or some issues that they've had. So those will be really helpful, but the more of these stories we can get, the better. We were able to do that with sort of towards the beginning of the pandemic. We were hearing from a lot of you that your hospitals were starting to either threaten or take action against clinicians and nurses who brought in their own PPE from home when the hospital couldn't provide it. And so we collected those stories. We assured everybody, their identity would be protected, anonymity, total anonymity. We removed any de-identifying information from it, whether hospital name or anything like that. And we were able to share those stories with CMS, with Joint Commissions, who did put out a statement shortly thereafter, kind of stating that the rights of clinicians to bring in their own PPE should be protected. And so CMS, Joint Commissions, we shared them with some of the hospital associations and just tried to raise awareness by some of these entities that this is an issue so that they could start messaging to hospitals that this is not okay to do. And so that worked really, really well. And we want to be able to do the same thing with physicians who faced issues in seeking mental health treatment in terms of either licensure or credentialing. And really the only way we can do that is with stories. And so I finally have the link now. If somebody does want to share an anonymous story like that, they can do so by going to surveymonkey.com/r/mental health barriers. Definitely we welcome those. And I think we'll probably put that link on acep.org when we post the full poll results on Monday in conjunction with that press event. So I think we probably have, one more question. Is there an update to the efforts to push a surprise billing solution via legislation or executive order? Yeah, that's a good question. There has been some renewed discussions around this, but I would say not any real traction that we've seen so far. We know that, when we last kind of left off, the president had put out an executive order that asked Congress, or that required Congress, to the extent that this is enforceable, to pass legislation, some kind of legislation to protect patients from surprise bills by the end of the year. Otherwise, the administration would take action with another executive order that would be much more, I think, kind of requiring significant changes. Probably more of a benchmarking or network matching approach, where if a hospital is in network with an insurer, the hospital would have to require any physician groups that are participating at that hospital to also be in network with the same insurers. And this is a completely unworkable solution. We've explained this to Congress, why, like all the various ways that this just would be terrible. But we know that that's what the administration was considering. So they didn't go through with it, but they did say if Congress doesn't do anything on its own by the end of the year, the administration will do something. Obviously, some of this depends on what's going to happen with the election as well. But before that, we had the Senate Help Committee and the Energy and Commerce Committee had come to an agreement on their approach, which is sort of has the arbitration approach that we of course advocate for, but it's structured in such a way that it ties far too tightly to median in-network rates. So it would still be pretty damaging for emergency physicians potentially. They've also put out, Senator Alexander and Senator Cassidy have now put out a joint press release stating that they've come to an agreement on a kind of compromise approach. We haven't seen the details of that yet. We've heard rumors of what's in it, but until we see actual legislative language, it's really hard to be able to comment on whether or not this is a good compromise or fair or not. So we're waiting on that. If Congress wants to kind of go down this road, we've encouraged them to share language earlier rather than sooner, so that we can weigh in on that and kind of flag any potential problems. So that language, I think we've heard about, it's been around since beginning of August, but I would say most congressional offices haven't seen it, and certainly we haven't seen it. So we're waiting on that. That's kind of where that is. I know that they are pushing hard for this to be probably in a year-end package. I think the year-end package is becoming kind of so fraught with everything and complicated and controversial that I don't know that this will be included in it. I think it's a little bit of a taller hill to climb than folks would have thought maybe 3-4 months ago. But that's kind of where that is. So we are continuing our advocacy, continuing to emphasize the need for a fair approach that does not, tie rates to median in-network, and explain to members of Congress what this is all about. Certainly, depending on the election outcome, there'll be a lot of new congressional offices that will have to educate on this very important issue, and we'll certainly hit the ground running doing that in January once they're sworn in, and we'll just keep taking it from there. So last question. I'm not sure I'm a member of NEMPAC's Give a Shift to be able to participate in those events that I talked about. How can I join? So to join, you have to be an ACEP member to join NEMPAC. That's just part of the federal election rules. But in order to do so, just go to emergencyphysicianspac.org, and it'll ask you to log in probably with your ACEP login. If you've recently logged into acep.org, you're probably fine. It'll just automatically kick you over to that. And there's a button on the top right that lets you contribute and also look up some of our resources, our election resources, and who we've contributed to, and some explanations of how NEMPAC chooses which members of Congress to contribute to. So that is it. We're just a minute short of the half hour. So thank you everyone for joining us, and we will see you in 2 weeks on continuing our new time, which will be the day after the election. Hopefully I'll have some election results to share with you by then, but we don't even know if we'll have that yet. I'm sure we'll have some partial results to talk about, and there'll be lots to go over. So we'll look forward to seeing you then. Thank you.